Sir.
This is episode 36 of the Progression Health Podcast. I'm here with Gary McGowan. Gary, would you like to introduce yourself?
Absolutely. Thanks very much for having me, Ross. So my name is Gary McGowan. I'm from Killarney, County Kerry, here in Ireland. And I'm a personal trainer and a student alongside that. So very interested in all things health and fitness, have been for many, many years. And that's why I end up on podcasts like this.
Brilliant. Yeah. You've a wealth of experience for somebody so young. So you are a qualified physio as well, is that right?
I am indeed.
Brilliant. Yeah. So what about being a physio didn't appeal to you that you're now studying to be a doctor? It's like pretty impressive to kind of do both, you know?
Yeah, well, I mean, it's not necessarily that being a physio doesn't appeal to me, because I definitely do a lot of physio work in my work with Triage. Triage is the name of my business that I run. Me and Paddy Farrell, and there's another physio on the team. We have a good few coaches. And so I do online coaching. And part of that, and previously when I did one-to-one personal training, part of that has always involved physio-like work, because I get clients who are injured, who other trainers don't want to work with. So it's still very much a big part of what I do in terms of my work. And obviously the knowledge has carried over to some degree to medicine as well. But to answer your question, I didn't want to take the physio path in isolation. It just wasn't something I had ever really intended to go 100% on, to be honest. Like, even going into physiotherapy, I had never thought that I would, just be a physio, and then that was my option. I didn't think of that, to be honest, because I initially did sports science. First year sports science, I decided, you know what, wouldn't it be good to do something that I would get a professional qualification out of and still gain the knowledge I want in these fields I'm interested in. So I kind of did the physio degree with the knowledge that I wasn't going to be all in on being a physio, but that I might use that knowledge somehow to pair with the health and fitness side of things. So that was kind of the reason for that. And during my time in physio gives you exposure to medicine. It gives you exposure to the hospital environment and different disease states, etc. So that was kind of what got me interested in medicine, just got me more interested in the medical side of things, pathophysiology, the treatment of disease, and so on.
Brilliant. Yeah. So the more personal training I do, the more I realize the crossover with, they call it physical therapists out here, but physio work and just injuries as well. So you definitely have like a really good all-around background. So then with the becoming a doctor, what do you have a plan around that, like moving forward? Does that tie into like kind of a personal training plan, or is it just you're following your interest, your passion?
Yeah, it's a hard one, because that's kind of what I'm asking myself every day now at the moment, as I kind of heading into my final year now, at the start of final year, and it kind of comes to the point where I have to try to make decisions about the future. And like at the moment, like the personal training side of things, the fitness business, that's going really well and has been going really well for a while. Gaining medical knowledge and being a doctor obviously gives that business additional credibility and gives us additional options in terms of the content we can put out and that type of thing. But I wouldn't say my plan is, solely to just use the medical degree for that purpose. I'm kind of trying to decide at the moment what exact specialty I'd like to do in medicine, and whether or not I want to do something that is for the purpose of blending with triage, like purely out of interest, or in terms of what I'm most interested in medicine. I'm most interested in neurosurgery and a couple of other surgical fields. And if I do go down that path, then that would involve going all in on that. You couldn't really be trying to juggle anything else if you were doing neurosurgery, or at least very little. So at the moment, it's about deciding what sort of trade-offs I want to accept, not just in terms of the work I do with triage or the work I do associated with fitness, but also in terms of other aspects of one's quality of life. Do I want to be able to see my kids regularly if or when I have them? Do I want to see my girlfriend regularly? Do I want to see my family? If you do neurosurgery and you're working 100 hours a week, it's very difficult to do all those things and to live a decent quality of life outside the hospital. So there's the decisions to be wrestled with more.
The Progression Health podcast has teamed up with TRX. So TRX is a bodyweight training piece of equipment that you can hook up anywhere, anytime. And I highly recommend it. I use it in every session with my clients. I use it to warm up and also for stretching. But if you are traveling, which is where I recommend everyone use it, it's hard to get to a gym. It's hard to find the time. But you could literally work out from your hotel room with the TRX and the door attachment that it has, where it doesn't damage the door, but it gives you an effective workout. I also like to add in other things like glute bands and resistance bands. But once you have the TRX, then you can figure all that out. So get yourself 50% off on the TRX home workout equipment with the code Progression Health TRX and boost your workout effectiveness and consistency. Progression Health podcast is brought to you by BetterHelp. BetterHelp is an online therapy service which will help you to more effectively manage your mental health. Mental health is very important, and it's something that all of us are realizing now, especially after the pandemic. During the pandemic, for me especially, it was very challenging, and I reached out to BetterHelp. I tried out a few of their licensed therapists, settled on one for the majority of the pandemic, and I found the help that I received invaluable. And the great thing also is that you can speak to your therapist outside of sessions. If it's not working out, you can switch. Very affordable. It's really easy to use also. And if someone hasn't tried therapy before, but you're kind of, you're curious, I would highly recommend BetterHelp. So what we've done is we've got a sign up link I'll attach in the show notes, and basically you can get a discount to get started and start improving your mental health today. So BetterHelp for better mental health.
Yeah. You don't want to make them too quickly. So all the qualifications you have, do you think that is kind of in a response to, we'll say, like the fitness industry or personal training, maybe kind of like lacking those qualifications? Because I see kind of like a trend with fitness companies like similar to yours, where they're becoming like more qualified, or they have like more layers to them. What would your thoughts be around that?
Yeah, I mean, there's probably some truth to that, in that, my interest in personal training and health and fitness drove me to go on and, get further education. However, it's not necessarily that I think that should be the standard of personal training or anything. Rather, I think like one of the things that, as you said, would be common among some other businesses and us at Triage as well, is that we want to have, to some degree, a higher level of education, or a diversified staff. So for example, we've got, people on the team who have degrees in nutrition, those who have degrees in physiotherapy, Nicola, who's got a degree in medicine, I'll have a degree in medicine soon, Paddy's got a degree in biochemistry, etc. We've got this bit of diversity within the team. And what that means then is that as we shift towards being a business that's more so emphasizing the education of personal trainers, we can do so being comfortable with the fact that, right, we know we have more knowledge than you need to know to be a personal trainer, and we're only going to deliver to trainers what they actually need to know. Because I think that's really important. So if you're an undergraduate student, let's say, doing a degree, you're not just being educated by people who have just finished the four-year degree. You're being educated by people who have a PhD. They have far more knowledge than you would actually need to complete this 4-year degree. And that's the kind of way I look at fitness education businesses as well. There should be a good few layers of education above what is required in order to deliver that knowledge effectively, while still being, of course, tied to the ground, skin in the game in terms of understanding daily coaching practice. Like, I'm not saying trainers need to understand medical knowledge, but if I have a good understanding of anatomy to a medical degree and physiology to a medical degree, then it's much easier to relay the level of physiology and anatomy that would be required for a personal trainer. Do you know what I mean?
Yeah. It's like a quote I heard recently is like, you can only take somebody as far as you've gone. I know that's very reductionistic, but like, yeah, if you only have a master's, you can't take somebody to a PhD level, or, kind of similarly thinking. So yeah, it definitely, it does you no harm at all to have extra qualifications. So yeah, just kind of bringing it back then to the actual like skin in the game and, the training side of things. What do you enjoy most just fundamentally about like exercise training that really kind of keeps you going and working out?
My perspective on that has changed quite a bit in the last maybe 3 to 5 years, because I would have initially started out training. I was more so interested in just your kind of typical lifting weights in the gym, getting stronger, building muscle, having a good physique, etc. That was what initially got me into training. However, over the last few years, I've delved into a few different a few different methods of training. You know, I started doing a bit more running, started working on my cardio a bit more. I took up Brazilian Jiu-Jitsu, and, you know, that's probably like my primary training goal at the moment. So for me, that's my primary focus right now, is to get better at Jiu-Jitsu, get better at grappling, and my weight training and any cardio that I do is effectively a supplement to that, which is very different to how I would have approached training in the past. But overall, I think the baseline really, in terms of, if I get down to the root of what I enjoy about training, I like the idea that you show up to the gym, you have a plan, you follow the plan. Following the plan makes you feel good, as in you leave the gym feeling good in terms of your mental health and your physical health. So you feel better in the moment, but also then long term, you can see that if you follow the plan, you actually improve. And that's a powerful lesson that carries over to every area of your life then. So there are both short and long-term benefits to exercising in any capacity. I think that's very powerful. The friction, obviously, is making the time each day, showing up to the gym, putting in the effort while you're there. But if you can get over those things and experience the short-term and long-term gain of regular exercise, I think that's ultimately what is the common thread between, you know, whether it's boxing or jiu-jitsu or bodybuilding or powerlifting. It's this idea that you can follow a plan, you can get these mental health and physical health benefits from doing so, and you can actually continuously see progress if you're training in an appropriate way.
Yeah, you can always get better. And then the more modes of exercise you have, the more variety you have and ways to get better as well. And then just with like working in the hospital and doing, like, I'd imagine you're doing more hours. How do you find doing, we'll say, the extra workload if you're doing that, but also managing your health? Is that like, would you kind of relate to your clients a bit more who are like maybe a bit older and they're like trying to juggle everything? They say they're busy and that kind of stuff. Do you find you feel that?
Absolutely, yeah. I mean, and that's been going on for a number of years. It's always a challenge. Like, for example, today is probably a good case because it just demonstrates the kind of juggling act where I started working on my triage work. So that's the fitness side of things at 5:30 until 7:30 this morning. Then I went to the hospital. It's now 6:30 when we started the podcast. So I just got home before this. I was in the hospital for 11 hours or so, or 10 hours maybe, take away the commuting. And now recording this podcast with you, I'll come off that. There's about 3 or 4 hours left between that point of the day and me going to bed. And in that time, the intention is to get an hour workout and to get at least an hour or two of work with triage again, and then to repeat. So with that type of time pressure, it's definitely very difficult to prioritize your own health. And I definitely accept some trade-offs in terms of dealing with more stress than probably is, you know, good for one's health, or optimal for one's health at least. Probably sleeping a little bit less than I should every now and then. I'm not too bad. Probably used to be worse, but not too bad. And then in the nutrition side of things, it can be very difficult to eat well if you're constantly on the go and you're in a rush and you don't have time to cook food. Generally, I tend to keep my nutrition in a decent enough place. Like, I don't tend to come home and binge if I've had a long day, or just eat crap or anything like that. Like, that does happen sometimes. I'll get a takeaway if I haven't eaten all day, but most of the time I keep my nutrition relatively decently in check, and within my calorie macro needs, etc. And then the training side of things, obviously it's very difficult to train when you're tired, you've been working long hours, you know, you just want to lie down on the couch. But to be honest, when I come home in the evening now and I'm tired, like, I know that when I go out to the gym, and I do have the luxury of having some gym equipment out the back here in my house, it's a case of being able to go out there, commit to starting it. And I know as soon as I start, and certainly as soon as I finish, I'll feel much better. I'll actually feel more energetic. So I think that a lot of that just comes with experience. I definitely do, as you say, empathize with my clients a lot more, because I do live in a way that's relatable for a lot of my clients in terms of them trying to juggle multiple things. And that definitely helps me a lot in my work as a coach, because I'm not, you know, deluded into thinking that, because you see this with some personal trainers, maybe, where, especially online coaches, where maybe all they do is do 4 to 6 hours of check-ins a day on their laptop, and they can do it from anywhere. They have no other responsibilities. They can train whenever they want, eat whenever they want. And then they're advising someone who maybe has 4 kids and a really intense job and, elderly parents that they're looking after. Just totally, it's very, very difficult to empathize with that if you haven't been there. So it probably brings me a little bit closer to some of those clients, as you say.
Yeah. And some of those clients that you're referring to that, that I would have myself, they say that the workout they do, it's like the highlight of their day. Would you get a sense of that? So even though you're doing a pretty hectic schedule and you're doing so much work, have you got to a place where you actually look forward to the workout like this is my kind of time?
100%. And that's like jiu-jitsu in particular really, really serves that purpose, because what I want, because like when I'm at work, whether it's triage or it's, medicine, whatever it happens to be, it's all, my head's always on, there's always something going on. You're always trying to process something or think about something or solve a problem or stressing about something. And that can be very taxing. And there's nothing nicer than just being able to go and train, just put in effort and just have your mind suddenly dissolve those problems, because that's kind of what it feels like. It feels like they're dissolving as you're working hard. And jiu-jitsu in particular, or else a really hard cardio session as well, I find to be great. I find that my head just starts to, detach from those problems. I'm able to just focus on the work that I'm doing, and suddenly I feel like I'm in my own world. Sometimes in weight training, I don't get the same effect, because there's always that period of time between sets where you're just kind of sitting there, and if you want to do an effective workout and actually get stronger, you do need to take a couple of minutes of rest. So sometimes I find that my head dips back in then to thinking about work or thinking about college. But when it's hard cardio or jiu-jitsu or something like that, I find it's an excellent form of escapism for me.
Yeah, it really is a good stress reliever. And then just with your injury, how have you managed that? Because like everybody is going to have an injury at some point. But if you look forward to your workouts and you probably have been able to work out as you normally would have, how has that been for you to manage that?
Yeah, so I was actually asked this. I did a podcast with another guy last week, and I was asked this question, and I think I would stand by my answer in that. For me, I suppose I should give some context for the listener. So I had a full hamstring rupture, which means that you take the 3 hamstring muscles that attach just under your bum onto the bony part there, and they ripped off that bone. What that means is that, if it pulls away so far, it's not going to attach back on itself. So I had to have a surgical repair. Had that surgical repair about 9 weeks ago. And then I just got out of my knee brace and crutches and stuff about 3 weeks ago. So I spent about 6 weeks fairly immobilized. Some pain, obviously a lack of mobility and function. And there were some difficult elements to that for sure. But as I said on that last podcast, and as I think I mentioned on my Instagram as well, I think that one of the things that's really important to protect you against the psychological consequences of injury is to have other things that you focus on in life and to have some other elements of your identity. Because you see this, for example, when athletes retire. If you were a professional athlete and you retire, suddenly there's this massive void in your life that nothing fills. And for a lot of people that retire, it might be alcohol and drugs, it might be gambling, it might be other types of behaviors that are suddenly starting to fill in that void. And that sense of identity for them was solely based on sport. For a lot of bodybuilders or, people who are really into their physique, their whole identity rests on their training, their nutrition, how they look, what their weight is, etc. It's all focused on that. So if anything happens that they're not able to do that anymore, suddenly they're dealing with the psychological consequences. In my case, if I was solely focused on my training, that was my number one thing, I had nothing else that I cared about or had going on, and I suddenly got injured, of course I'm going to be in a psychological spiral. It's going to be very, very difficult to deal with. But thankfully, I was able to divert more of my attention towards my work, towards, my studies, towards other things that I have going on in my life, because I don't just view myself as Gary the athlete. That's not my sole identity. Was I still keen to keep up training? Yeah, for sure. And I did a little bit, but not near as much as I normally would. I was only able to do a little bit of upper body stuff. But I think that's the biggest protective factor for me, is having those few different elements to my life, so that when one thing maybe isn't going so well, I can divert some more attention somewhere else. And I think that keeps me pretty stable.
Yeah, you have other interests to turn to. So just kind of like on a basic level, like let's say, for example, you manage your weight or your physique, so your nutrition, and then like your level of energy or your cardiovascular fitness, I'd imagine they would have taken a hit. And if they did, like, how did you feel with those sort of challenges? Being less active, your calories would have been affected and that kind of stuff.
Yeah, and to that note, I suppose one of the things I do note when I'm not exercising is that there's definitely like this kind of level of low level anxiety that feels like it bubbles up that I need to release. It's like you've got a fully charged battery that just wants to be emptied. That's how I always describe the feeling of when I don't exercise. And that obviously was not able to be satisfied to the same extent, because I find that if I'm able to go out and really, crush a cardio session or do a really hard session when I'm feeling like that, that's what clears it. But, when my leg was that bad, like I could only do a few bicep curls, light chest presses, etc. There was nothing really where I could go out and just, empty the tank and get after it. So definitely not saying there were no psychological consequences, because I definitely didn't have that same release. In terms of the body weight, nutrition side of things, my appetite tends to regulate itself very, very well these days. I'm very lucky in that sense. In that if I stop training, I just won't be hungry. I know a lot of people aren't like that. A lot of people maintain their kind of ravenous appetite regardless of how much they're exercising. But for me, my appetite will skyrocket when I'm training a lot, and then it will totally drop off if I'm not training. Like it could be some days, if I was just working, it could be 4:00 in the day and I'd be thinking, oh God, I haven't eaten. That happens if I'm not exercising. So for me, during that time, it was actually more of a case of, trying to remind myself to have meals so that I could support my recovery. So I didn't really, like, my body composition did probably worsen a little bit, because what I was trying to do was be around maintenance, probably ended up in a slight surplus, but I wasn't training hard enough to be stimulating muscle growth. So probably gained a little bit of body fat, lost a little bit of muscle, especially obviously in the legs. But that didn't impact me too much, because I really just wanted the leg to be better. That was the primary goal. So yeah, I wasn't tracking calories. I was just allowing my appetite to kind of regulate itself, and then making a conscious effort if my appetite was too low to try to especially get my protein up. And that was most of how I tried to handle it.
Sounds good. Yeah. And then I'd imagine a lot of people, like even the listeners who wouldn't be experienced with the injury process, the rehab process, they'll be like, oh, I've worked so hard in the gym or whatever sport they play, and I'm going to lose all my progress, all my gains. Did you kind of, have that challenge, or do you have any advice for anyone who, if they get injured and they have to manage that side of things?
Yeah, part of it is firstly understanding that some things are beyond your control. And I know this is so much easier said than done, but stressing about things that have already happened and that are now beyond your control and can't be changed is only going to make your situation worse. And I suppose that comes from, to some degree, you can use like the principles of Stoic philosophy to try to help yourself there. Kind of related to some of the principles of cognitive behavioral therapy in terms of challenging irrational thoughts. Like, for example, if I'm wallowing about the fact that I got injured and I'm saying, oh, I'm going to lose all my gains, I'm never going to get back to where I was, trying to write down, if I would advise someone else, if they're worrying about it, write down those thoughts, try to challenge them, try to say, is this actually rational? Is this actually a reasonable outcome? Is this something that's likely to happen? Is it something I have control over? And try to just focus your attention on the things that are really within your control. And the way I would try to do that, in my case, is, right, I couldn't walk a few weeks ago. Okay, I wasn't able to walk. Now I can walk, and I've walked, multiple kilometers. Huge win. I'm not worried about Gary that deadlifted whatever 220 kilos for reps. That doesn't exist right now. Doesn't exist. So I'm not even setting that as a goal. So for some people, it's helpful to have the longer term vision of like, that's the level of strength I want to get to. For me, I'm focused far more on what's the next step in this process? What's the next step in this process? Because something I've learned over the years is that rehab is very, very unpredictable, and you'll drive yourself crazy if you're trying to have this super linear process of, at this month, I'm going to be here, then here, then here. All you'll end up doing is disappointing yourself, because almost inevitably there's going to be peaks and troughs. There'll be weeks where your knee is sore. There'll be weeks where your back is sore. There'll be weeks where you're performing brilliantly, and then the weeks where you're suddenly regressing. That's just part of the rehab process. And I understand that's part of the process. So for me, I'm thinking, right, I can walk now. Next goal is to be able to run a kilometer or jog a kilometer, because I haven't done that yet. So that would be a nice thing to work towards. When I last tried to do a lying leg curl, I wasn't able to do a single rep with no weight on the machine. My hamstring was that weak, no weight on the machine. So for me, I'd like to get to being able to do the first plate for 10 reps. It's those small little milestones that allow you to feel like you're building up momentum. And again, while I think it's nice to have an end vision of where you want to get to, I really, really encourage people to focus on that next step and actually celebrate those wins, because that's how you start to, have a positive psychological experience during the rehab process. Because like the psychological part of getting injured and the rehab process is almost just as, if not more challenging than the physical aspect. Because, for example, when I had my injury and then I had my surgery, a couple of weeks of pain, for sure, that wasn't so nice. But after that, like, I'm not in pain anymore. It's more so functional deficits. And the way that manifests as a challenge, of course, there's some functional challenges. You can't go walking, you can't go climbing, but a lot of it is the psychological aspect. And that's what a lot of people struggle with. So what I suggest is map out those small little mini milestones. What's the next step? What's the next step? What's the next step? That's how you'll build momentum. And you'll be 6 months, a year down the line, and suddenly you'll be saying to yourself, oh my God, how did I get here? I didn't even notice. We were just adding a rep here and there. We were adding an extra 100 meters here and there. And suddenly I'm running 10K, or suddenly I'm deadlifting 150 kilos again. That's how you get there. It's not by going from A to Z. It's taking each small step along the way.
Yeah, very much like training in the gym and using progressive overload. So,
Exactly.
So with just the injury as a whole, what has been like the single most like challenging aspect of it, and then the most rewarding aspect of it?
I think the most challenging aspect is, I think the fact that I had to have surgery was the most challenging aspect, because when it comes to a surgical intervention, right? So that hamstring was not attached. So I had a choice of getting surgery and fixing that, or hopefully fixing that, or just not having hamstrings anymore. So the fact that I had to have surgery, I was more than happy to have surgery, of course. It was the right choice. But I knew going into surgery that this still mightn't work. And even now, I know that it might not reattach properly. My last MRI just a couple of weeks ago, it's better than the initial one, pre-surgery. Like, surgery definitely helped, but it's still, it's questionable whether or not I'll get back to full strength. It's questionable whether or not those hamstrings will really be injury resistant once they're challenged again. There's still a lot of fibers that aren't attached. There's still a lot of damage to the muscles. So I think that for me is the hard part, because you're no longer dealing with the same anatomy that you would have been. You're now dealing with anatomy that has, been surgically intervened on and has certain limitations that I'm hoping my body has the capacity to overcome. Now, it's not something I worry about. Because again, like, my perspective on that is, I put my trust in my surgeon. He's a very competent surgeon. He has my trust. And for me now, it's about following through on the rehab. So I'm focusing on what I can control. But I think that just that element of things where it's a severe injury and it required surgical intervention and you're now dealing with slightly different anatomical state, I think that was definitely a challenging part and remains a challenging part because there's just some uncertainty as to, will I get back to full capacity? So that'll be a challenge. And then I think the second thing you said was the
most rewarding then. What would be the most rewarding part of the process?
Yeah, I think, let me see, most rewarding part. Do you know what? I think the fact that it didn't affect me that much psychologically was really, really reassuring for me because I thought it would, to be honest. I thought it'd hurt me a lot more than it did. Even like the second that I went to the ground, the second I hurt it and I felt the pop, I knew it was ruptured. I said, fuck it. I'm after rupturing my hamstring. And the people around me were like, no, you didn't. It's probably just a strain. No, I was like, no, I'm after rupturing it. It popped off. And the second I went to the floor, I thought, oh, that's my summer ruined. All my plans. I wanted to do all this jiu-jitsu training and, I'm not going to be able to train because I just come out of exams and a tough year at college. I was so excited just have an intense summer of training, going out hiking. I'm an active person, love that. And I was like, oh my God, the next few months are just ruined now. And I thought it'd be a lot more of a negative experience. But to be honest, it wasn't in the end. And that's reassuring for me because it taught me that, if this happens again, or if I happen to have any sort of illness, or for whatever other reason I can't train, that I'm able to still be a well-functioning, well-adjusted person in the absence of being Gary, the athlete, if you will. So I think that's a valuable lesson for me. And I think that's probably a valuable lesson that a lot of trainees would like to have in their lives as well. Because I know a lot of people who even struggle with, going on holidays or moving away for work and things because they get real anxious about the thought of not being able to train at their best for a while because it's such a core part of their identity. So I think that's been really valuable for me.
Yeah, dealing with uncertainty, like you said, in the challenge is tough, but knowing how strong you are, how capable you are when faced with adversity is like an invaluable lesson. Really. So you're kind of talking a bit about doing the cardiovascular training, the running, the gym, and then jiu-jitsu. So we're really talking about like concurrent training, so like doing two different modes of training at the same time. So can you just talk about how you manage that and recommendations for people who are trying to do like the gym, we'll say, and some like, some other sports. So for example, I do resistance training and then I'm doing a bit of running. What would you say just to keep in mind when you're doing the two of them at the same time?
Yeah, so this is a really interesting topic because it's an area where there's a lot of common mistakes that people make, and then maybe some misconceptions that are layered on top of that. So if you look back to some of the early research on concurrent training, this kind of spurred a lot of concerns about people not doing cardio because it was going to ruin their gains. But the research that demonstrated those initial effects was basically taking a intense weight training program that you or I might do if we were focused solely on weight training, and an intense endurance training program if you or I were focused solely on endurance training, and lumping them together. And that for me is the biggest mistake that most people make, is that they, instead of saying, like you said, how should a concurrent athlete train? They say, how does a runner train and how does a bodybuilder train? Cool, gonna do both. Okay. That's not how it works, because unfortunately there are limits to how much we can recover from and how much we can adapt to as well. And if you go in just trying to do the bodybuilders program and the runners program, that's going to run you into the ground. It's going to compromise your results in both domains. And it's also going to probably put you at increased risk of injury, illness, etc. So what I always suggest to people is, and this goes in both ways, but let's just use the example of someone who's maybe only been going to the gym lifting weights and they want to add in some cardio. I always say to them that if you want to, take up some running and you're now going to the gym, let's say 5 days per week, training hard 5 days per week, start by taking your weight training down to maybe 60% to start is what I would say. 60% of the amount of volume that you were doing previously. So for example, if you were doing 5 hard days, now you do 3 hard days, okay? Or maybe you just do 5 moderate days, but let's say 3 hard days, and then you add in your 2 runs on the other days. Because if you can start at 60%, you've opened up a decent chunk of your recovery capacity, your energy, your time, etc. And you can then see where that threshold is, because it genuinely might be that you can do those 5 hard days and run twice a week. And then it depends how hard you want to take the running. If you want to run 5 days a week because you're training for a marathon, you're going to need to bring that percentage of your weight training back down lower and lower and lower. And that's often what I'll do with concurrent athletes, because I coached a client of mine, a very impressive client, towards 100K run last year. And when he was doing that, obviously we had to do a lot of running, but he's a big guy, like a big, strong guy, deadlifts 200 plus for reps, not your classic ultra marathon runner. But so he had a big background in weight training. And what we did is that, let's say 6 months out, he might have been doing 4 weight training days per week and maybe 3 runs. Then when it came to 4 months out, he might have been doing 3 weight training days per week, 3 to 5 runs. 3 months, 2 months, 1 month out, you get where we're going, where we got down to the point where we were doing at the end, just 1 to 2 maintenance weight training sessions per week while really pushing on with the running. And that's how you should be viewing it. And I think that if people can start to maybe periodize their training a bit more, especially if they want to take 2 things seriously, that's probably the wisest way of doing things. Where, let's say you want to run a marathon. When is the marathon? Okay, pick a date and then adjust your training accordingly. So let's say it's August now, you want to run a marathon next March. You can continue your weight training, to a pretty intense level, maybe up to November, December. And then as you get into the early months of next year, you'll focus solely on the running. So it just depends on how serious you want to take each respective activity. But the main pieces of advice would be, number 1, don't try to do both. Try to do a bit of both. That's how you will be able to start with concurrent training. Number 2, don't do it for the purpose of burning extra calories. This is one of the biggest mistakes. People take on extra activities and they tell themselves they're doing it because they want to do these extra activities, but really they're just justifying burning more calories so they can eat more. And that's not always smart, okay? I would encourage you to try to fuel your training. So don't take on running without changing your nutrition, then push yourself into a massive deficit. Of course, you're not going to recover well from your training then. So try to fuel it if you're genuinely training for performance. And then I suppose the last thing then would be to be very honest with yourself. Be honest about what it is that you can recover from and what it is that you are actually trying to achieve from your training. Because a lot of guys will be very resistant to drop back their weight training because they say, oh no, I need 5 days. It's what I need. I have to be in the gym 5 days. I have to be taking every step to failure, just because it's what they've always done. But deep down, they know that they don't actually need that much to just maintain. And if you can just get comfortable with the idea that it's okay to just maintain in the gym for a while, and that level of maintenance is actually much lower than what's required to progress, that's going to allow you to bring in these other activities into your training regime a lot more smoothly.
Yeah, it's making me think, don't do extra activity for fat loss. Like, don't try and use cardio as a way to hit your physique goals. It's going to be ineffective. And then also, kind of in the words of Jocko, prioritize and execute, prioritize, a time frame, a timeline, and then that'll simplify everything from there. So then just in terms of managing activity and injuries and pain. So can you explain the difference between pain and injuries? And then would you say then for jiu-jitsu, I feel like maybe this is a myth, but I feel like there's a higher rate of injuries in jiu-jitsu. So what are your thoughts on that?
Yeah, so one of the difficult things about studying rates of injury in any sport is that we don't always have a clear idea of what an injury actually is. Like if you talk to jiu-jitsu guys, they'll always have a joint that's at them. They'll always have something that's at them. And some of this is down to the nature of the sport, and some of it's down to the nature of the athlete. And it's also down to what a person considers to be an injury. And that's kind of what you're getting at with the difference between, pain and injury. Because, for example, with jiu-jitsu, you're taking your joints into all of these really weird and uncomfortable positions that you're probably not going to get into during other activities. So, for example, if someone gets me into a type of shoulder lock called an Americana or a Kimura, and your shoulder's really rotated, it's putting loads of strain on your rotator cuff muscles, all the internal joint capsule and ligaments that you wouldn't really experience during any exercise in the gym. And if I have deep delayed onset muscle soreness in that as a result, it's going to feel like a real deep within the joint pain that, feels like an injury. Is it injury, or is it just kind of muscle soreness that is similar to what I might experience in the gym? Sometimes it can be difficult to tell those things apart, particularly in a sport where you're being so forcefully put into these extreme positions. So when it comes to pain can be present pain can exist in the presence or absence of tissue damage. So that's one of the difficult things about pain, is that it doesn't always correlate with the amount of damage that exists within a tissue, whether that be, a muscle or a ligament or a bone or whatever. And that's very difficult for people to conceptualize sometimes, because they have this idea that hurt equals harm. So if I have pain, then that means something is damaged and I need to stop doing this activity. But the reality is that there's a lot more going on at the level of the brain and the spinal cord and the nervous system that modulates the level of pain that someone will experience. And that's going to vary between individuals. It's going to vary by culture. And it might even vary within microcultures like sports, for example, where in some sports you might actually take pride in just, tolerating your pain and locking it down and not letting it show. And that doesn't mean that the internal experience is necessarily different, but the suffering might be a bit different, and the way that manifests, or the way that stops someone from training. So jiu-jitsu probably does have a relatively high rate of injury, and a lot of this does come down to the fact that you have a lot of control in jiu-jitsu in terms of, if you're put into an extreme position, you always have the choice to tap. It's just training. So you can liken it to the gym, where, let's say, Ross, you're doing a squat this evening in the gym, and
which I will be doing.
Yeah, good man. Right. What's your 5 rep max on a squat?
So it's in pounds. So like 340 or something.
Nice. So Ross is going in this evening. He's loading up 340 on the bar, 5 rep max. He does his 5 reps. He doesn't have any more reps left in the tank, but he goes for his 6th anyway. So you go for that 6th, you're grinding it out, you're stuck, the bar's crushing you, and you fall to the floor under the bar. Okay. You had the choice to tap out on that 5th rep. You had the choice to stop and to be smart. This is why we use things like RPE, for example, in terms of auto-regulation in the gym. In jiu-jitsu, you have the same thing in the form of a tap. You say, right, tap, I don't want you to put that joint any further. Unfortunately, a lot of guys, much like the guys in the gym who don't want to stop anywhere before failure, a lot of guys in jiu-jitsu do the same thing, where they'll let someone take their joint further and further and further and further. And even though it's not competition, all they're doing is training in the gym with their friends, their training partners in their club. They'll still let their partner push their joint far too far. Then there's a crack, a pop. And that's how you ultimately end up getting injured a lot of the time in jiu-jitsu. Of course, there are more catastrophic injuries, like you fall awkwardly, 2 of you fall together on top of each other. That's kind of what happened in my situation, where it was a takedown type of event. I fell, the guy's weight was kind of on top of me, my leg was overstretched. Very difficult to prevent those types of things, like in many sports. But there is definitely a lot that people have control over that they don't take control over. And that's what I always say in terms of bodybuilders, powerlifters, etc. One of the best things you can do to try to reduce your risk of injury is to be a mature athlete in terms of managing the load that you're exposed to, both in terms of your effort. Like, are you taking every set to failure? Do you really need to do that? No, you don't. Okay. if you're doing that all the time, that's immature training, especially like long-term over multiple decades. So you just have to be smart with those things. I didn't answer your question really about the difference between pain and injury. As I said, pain can exist in the presence or absence of tissue damage. Pain is effectively defined as an unpleasant sensory and emotional experience that basically resembles tissue damage or can exist in the presence or absence of tissue damage. That's roughly the definition given by the International Association for the Study of Pain. And that's clearly a very messy definition. And it is for a very simple reason, and that's because pain is very complex. Okay. But injury itself then is probably, injury is defined in a number of different ways as well. I didn't look up the definition before this or anything, but sometimes it'll be used in studies in terms of whether an athlete had to miss a session as a result of this insult. Or sometimes people might say, all right, an injury is very clearly something where tissue damage is present. But again, that's not really enough, because a lot of us have different problems that we could identify if we did a scan that wouldn't necessarily cause us any symptoms or problems. So that's one of the difficulties about this area of pain and injury.
Yeah, it's highly, highly individual. So just in terms of people's mindset with like injury, should people... So I would have thought when I was younger that if you get injured, you did something wrong. But now I'm kind of updating that to more of a place of like, no, you're actually going to get injured. It's going to happen. And it's more a case of like, instead of complete avoidance, it's like management. Like injury is a case of managing it as it comes up and kind of being, like you said, like a mature athlete, getting better at managing injury. Do you think people should expect at some point to get injured, but just to be better at managing it? Or is it realistic to think that like we could go through our whole lives without getting a serious injury?
Yeah, I don't see how you could. I don't think you can train hard in any sport, at least, without getting injured. And to be honest, like I don't know anyone that hasn't gotten injured. I can't think of a single person, athlete or not, who hasn't had some form of injury, because like life just happens. And I have niggles all over my body every now and then where my knee might be sore, maybe my ankle might be sore, or my elbow might be sore for a while, or my shoulder. These things just come and go, and they're part of the normal cycle of training. I don't consider them to be injuries, but other people might. And that is one of the difficult things here. I think that experiencing, niggles, maybe you have a bit of pain in your shoulder for a few weeks, it's sore at the bottom of your bench. These are normal parts of training. They're going to happen, because you can't be pushing the bar, literally and metaphorically, with training consistently over multiple years or decades and not cross the line every now and then. You're going to at some point push it a little bit too far, or you get into an awkward position, or it falls awkwardly, or you drop the bar too fast. There's so many things that can happen that it's totally unrealistic to expect that you won't ever push your body a little bit further than it was ready to go at that point in time. And if I look back, have I had multiple injuries? Yeah, I have. But this is the first one that is probably what I would consider a severe injury. I've had a few moderate injuries in terms of ankle ligament sprains, or what else have I had? Maybe some fractures, a couple of fractures, things like that. They're moderate injuries. And then the others, I call them niggles, because they're just minor injuries. Like, if I do too many sets of squats, my knee will hurt for a while. I don't worry too much about that, because I'm just like, well, this is just part of the training process. I do less squats for a while, reduce my training volume, and modify my range of motion for a couple of weeks, and then I'll be back at it again and I'll be fine. I appreciate as well, though, that I'm in a bit of a privileged position, in the sense that because I have the physio background, it's easier to reassure myself when those things come up. Whereas with other people, I can see how maybe if you heard something pop in your back while you were deadlifting and you felt pain in your back and it was still sore the next day, it might actually be really worrying for you, because a lot of what we learn about pain and injury comes from what we've been exposed to growing up. So for example, let's say you had that grandaunt that has had she's always had a sore back for 20 years and she's, crippled on the couch. She's never been able to get up, and, your whole family is always warning about back injuries. That's going to influence the way that you think about back pain, and is thus going to influence your interpretation of that pain when it occurs. So I do appreciate that it's quite different being in my shoes versus being in the shoes of someone who might worry a lot about injuries as they pop up. But to answer your question, I don't think it's realistic to expect injuries not to happen. I do think you can obviously reduce the risk of them happening by training in a smart manner, as you said. But even with that, especially if you're playing sport necessarily involves some element of chaos. Like if you're doing a combat sport, you're doing a field sport, any type of sport really, there's always an element of chaos and unpredictability, and you can't control every variable. You'll drive yourself insane if you try to.
Yeah, so kind of have a realistic outlook, and then also I think if you do have a niggle or an injury, don't catastrophize and make the situation worse. Exactly. Yeah. I was going to just touch on low back pain, actually, that you mentioned it. I was going to just say, why does it seem to be such a common injury?
Yeah, so it's definitely multifactorial. So low back pain is, as you say, very common. There's a number of different, I guess, sources you could have in terms of the structures that could be a cause or contributor to low back pain, including the intervertebral discs. They can herniate, they can bulge, they can, press on some of the spinal nerves. You've got, degenerative changes that can occur within the spine. This is very common with aging, a very normal part of aging, to be honest. It's like the graying of our hair. Our spine is, susceptible to similar changes in terms of degeneration. Those things can lead to pain. You can have, muscle strains that occur within the back. You can have some of the other joints, the facet joints. You can get problems with those. Lots of different things that can occur. And obviously, we use our backs a lot. So anytime, you're standing up, your back muscles are always on. You're bending over, your back muscles are always on. So they're always doing a lot of work for sure. People who are doing, physical tasks, sometimes, if they're bending over and they, move into an awkward position, or they were doing too much, they might have, low back pain following on from that, whether it be a minor muscle strain, or sometimes you can have a disc bulge, whatever it happens to be. So there's that physical element to it where there's just a lot of different things that your back is involved in. And we can be exposed to a lot of load in some cases, particularly in, heavy physical jobs. And sometimes if you have a low level of physical preparedness and you're doing something that you weren't used to, low back pain can result from that. So for example, you're not typically a physical person, you're not going to the gym, and suddenly you're asked to move the couch or move the fridge. That's almost always how it happens. It's these small little menial things where someone bends down to pick up a pencil and they're not used to being down in that position, and then they tweak their back. So there are some of the reasons that it occurs. We know as well that low back pain, can be present in the absence of any of these changes that we've discussed, or that I just mentioned there, in terms of there being a clear identifiable cause. And that's the case with most low back pain. We're not really able to say exactly what's contributing to it or what caused it. And we know that things like depression, anxiety, they can all increase risk of low back pain. High levels of stress and other psychosocial factors do significantly contribute to risk of developing low back pain as well. And, some of those things might have to do with, I guess because the interpretation of pain or the amplification of pain to some extent, where, you might have a bit of a sore back. And if you're, like the word you used earlier, if you're catastrophizing about that, you're really worried about it, you're constantly trying to protect it, you're, bracing your core and trying to move really rigidly to deal with that little bit of pain that you had, you're drawing all of your attention to it all the time. And that can actually lead to quite a bit of suffering in the presence of low back pain, where it mightn't have actually been a big thing initially, but it's now become a big thing for you psychologically. And that's not to say you can think your way in or out of pain. It's not that simple. But there are, psychosocial factors that are important there. With all that said, we don't necessarily know why, low back pain is so common, and there aren't great treatments there very often for low back pain. We know that a certain proportion of people will develop low back pain, and it won't get better for quite a while. You know, even if you listen to your physio and you do your exercise or you get a massage or whatever they tell you to do, sometimes it just won't get better. And that's one of the really difficult things about communicating with people in terms of pain. Sometimes people don't get better, and that's very, you know, difficult for people to take at times.
Yeah, that's a scary thought, but we'll just keep on trying anyway. So we'll try our best. We'll try our best, but
most people will improve. I should say that, and you know, it's not a dark note to finish on. If you hurt your back, it's probably going to get better. You're probably going to be fine. You know, I see this all the time with clients. They tweak their back deadlifting, no stress, right? We modify the program for a few weeks. You'll be fine in a few weeks. Most back tweaks are not serious. Most back tweaks or back pain that you experience is not a big deal. There can be some cases where it is, but most cases it's perfectly fine. And what I would also say, given that this is, I suppose, you know, your audience are probably gym goers. I would say a lot of people probably go to the gym. Think of your back similar to how you think of your quads or your biceps or anything else, because this is one of the biggest things I see among gym goers in particular, where if they experience back pain, even if it just is like delayed onset muscle soreness, it's suddenly a big deal. Whereas they celebrate their quads burning, they celebrate their biceps burning, they celebrate their pecs burning. Totally different when it comes to the back. You know, someone does a workout, even if they're working their low back muscles, during the workout, those muscles feel really pumped and sore. They're worried about that. They treat it very, very differently to how they would treat it if that pump or intra-session pain was to exist in another muscle. So remember, they're muscles. They grow, they get stronger, and they will fatigue and burn just like any other muscle during training.
Yeah, and don't wrap yourself in cotton wool either and stop moving and, you know, completely 100%. Stop exercising. Yeah. Do what you can with what you have.
100%.
As someone who's got injured, or I'd say experienced a lot of pain in my back, that walking is a great way to go, even though it's probably not as intense as, you know, the deadlift you would have done or whatever it is.
What's been your worst injury?
My worst injury, I dislocated my shoulder. I had a grade 3. I got hit by a car out here in San Francisco. I had a grade 3 dislocation, and it's crazy. Yeah, I have a titanium plate in my shoulder, and now I'm like, so my coach, his nickname was like Titanium Strong. So it's kind of like, I kind of made this whole story of like, oh, I'm titanium strong now because I have a titanium plate in my shoulder. And actually I did a powerlifting meet after. So it's like, I actually did get stronger kind of in a way. So injury isn't the end of the world. And you can definitely, you can learn a lot from it. Like there's a silver lining to an injury for sure.
So I'm flipping it back on you now. Now tell me, what was the biggest challenge with that for you and the biggest reward?
The biggest challenge, the inactivity, I would say. It's a good question. Yeah, inactivity, just not being able to do your regular schedule, your regular activity that you wanted. And then you kind of actually, in a sense, you almost feel weaker. You almost feel less capable. When in reality, it's just you're dealing with a setback. That's all it is. And the most rewarding thing then was, I guess, just being able to relate to clients and being able to say, you know, I actually know how it feels, because up to that point, I actually hadn't had a serious injury. So in a way, as I kind of said already, I'm kind of glad that I got injured, which is really interesting to say out loud. Like, no, I'm glad I got injured, but yeah, I am, because I guess I'm very fortunate that I came back to the level of strength I'm at now. So, it definitely had a silver lining.
And that happened to you out in the US, did it?
It did, yeah.
And what was the process like in terms of seeking healthcare then and stuff?
So I just decided to come home and get it,
I was going to say, because I was only having a conversation with someone about this last week, that like, if you were living over in the US, do you need to have US health insurance? Can you have health insurance from Ireland that would cover you, or what happens if you were to get that operation there? Like, I imagine you'd be talking tens of thousands.
Yeah. So I was recommended to come back here, and luckily I was able to get it taken care of and got everything sorted, and I'm 100% now. Don't even notice the difference, which is mad. You can actually physically see slight dislocation on one side to the other, but I don't feel a difference, which is like, you know, really just blows my mind. But yeah, you can really make a full recovery, and hopefully you do too as well. Or no doubt you will, you know.
Hope so. That's class though. That's class that you had that great an outcome from surgery. Brilliant.
Yeah. And I would say actually I was fortunate that I had a coach at the time. So I would say like that's where coaching comes in. You know, you have that kind of ear to talk to when you're struggling, and also a bit of support then, like to just kind of do what you can with what you have and start rehabbing, like you're doing that little bit of training to get back, you know, building that strength up again.
Absolutely, absolutely. You don't want to, I think that's an important point, is being totally on your own in the presence of injury it can make it more difficult, because you start second guessing everything. You don't know where to start with things. Sometimes you get stuck in a bit of a rut of doing nothing. Whereas, you know, when I was able to initially, when I got injured, consult with sports medicine physician, talk to some of my physio friends, you know, consult with the surgeon, all those types of things. You know, it feels like there's people in your corner now, and we have a plan. So that's something I would say to people as well, is, you know, if you're in a position now where you're injured, maybe you've had pain that's ongoing for a while, you've stopped training and you're like, is this the right move? Get some people in your corner, get some people holding you accountable, maybe hire a coach, or whether it's see a physio or whatever. Just have people in your corner that are helping you to build a plan and hold you accountable. And that is really what will help you get out of that position where you can just get a bit stuck.
Yeah. Have a bit of support and a team as well around you, just as much as you can to lean into, because it's going to be tough. Like an injury is going to set you back.
Any questions they'd like to ask me after? Like, I appreciate this wasn't the longest or most detailed episode. We touched on a few things. There's quite a lot more you might be thinking in your own head. So feel free to reach out to me, Gary at SkinnyGaz on Instagram, or if you want to contact Triage at Triage.
Thanks very much. And to everything you said earlier about reaching out to you, you're very given with your time. So I'd encourage anyone who has any questions for Gary to reach out to him. He's very knowledgeable. So thanks very much.